Welcome to our today's discussion, whereby we will be learning about the bones of the leg and foot. So please remember about the previous discussion, whereby we were able to deal with the bones of the thigh, and we identify this long bone known as the femur, and as well we did about the bone of the knee, which is the patella. So without much ado, let's move ahead and check about the bones of the leg and foot. So please remember to subscribe my channel. As usual, Yan Medi Okalo. So as we proceed, we will start with the bones of the leg. And we have with us, the leg is made up of two long bones, and these are tibia and fibula. So the position of the leg is just immediately after thigh, and the distal aspect of the limb, or the distal part of the lower limb, we have the leg. And for with us, the leg is made up of these two bones, which are the tibia and fibula. Right on our background, we have the images of these two bones, which I'm discussing about. So with us, we have the tibia, which is thin at its shaft, then expanded proximal end, and as well the expanded distal end. So we also have the fibula right here with the head on top, and we have the lateral malleolus at its distal end. So this is just but a brief overview of the two bones. So this is the anterior view of the bones of the leg, while this other one is the posterior view of the bones of the leg. So let's move to the more detailed anatomy of these two bones. And with us, we have the tibia and fibula. This is the anterior aspect, while this other one is the posterior aspect. So the part labeled here as one is the lateral condyle of tibia, which is just right here. So this part is noted as the lateral condyle. So it's more visible at the anterior aspect. And remember, as we will be discussing, we will be identifying about this lateral condyle and the medial condyle, which I'm just about to show you, which makes up the tibial plateau. So one, as I've said, is the lateral condyle. So let's check on the other parts. So the part labeled 2 is the position of tibiofibular joint. And for our case, this is the proximal tibiofibular joint because it's found on the proximal aspect of these two bones. So the part labeled 3 is the head of fibula. 4 is the interosseous border of tibia, and this is where the interosseous membrane attaches the tibia. For 5 is the shaft of fibula. Shaft is as well known as the diaphysis. In 6 is the interosseous border of fibula, where the interosseous membrane attaches. Then 7, we have the lateral surface of fibula. And 8, we have the distal tibiofibular joint, or the position of distal tibiofibular joint. So these two bones articulate at their distal end at this point. So 9 is the lateral malleolus. Then 10, we have the medial condyle of tibia. Then 11 is the tibial tuberosity. So keep following as you'll find the functions of this surface anatomy of these two bones. Moving to the part labeled 12 is the shaft of tibia, or the diaphysis. Then 13 is the anterior margin of tibia. 14 bringing us to the medial malleolus of tibia. Then 15 is the inferior articular surface of tibia. So these are the whole anatomy, or the surface anatomy, of these two bones when viewed from the anterior aspect. Now let's move to the posterior aspect of these two bones. And with us, the part labeled 16 is the intercondylar eminence. Then we have the 10, which we were able to identify from the anterior aspect, being the medial condyle of tibia. Number 2 is still the same, the position of tibiofibular joint at the proximal end. Then we have 22 is the apex of head of fibula. 3 is the head of fibula. The part labeled 17 is the solid line. Then 18 is the medial border of tibia, which is next to the midline of the body. So, and the part labeled 19 is the posterior surface of tibia. Then 20 is the malleolar sulcus of tibia, and finally 21 we have malleolar articular surface of 21 is the malleolar articular surface of fibula, which is right here. Then other parts like 23 is the posterior surface of fibula, just as the other one of tibia, which is part labeled 19. Then number 6 is the interosseous border, as like the one we have just seen from the image of anterior aspect of these two bones. So let's keep checking what's all about these two bones. For tibia, we have tibia is the larger medial weight-bearing bone of the leg and forms what is commonly known as the shin bone. The tibia is the second longest bone of the body, just after the femur, which we were able to check from our previous slides. Tibia articulates at its proximal end with the femur and fibula, and its distal end with the fibula and talus bone of the ankle. So these are the joints formed by the bone tibia with other bones which it articulates or which it comes into contact with. So for the proximal part, we have the fibula and the femur, and they constitute to the formation of the knee joint, while at their distal aspect or the distal aspect of tibia, we have the fibula and the talus bone of the ankle, which bring us to the joint known as the talocrural joint or the ankle joint. For the joint formed by tibia and the femur and as well the fibula, we have the knee joint, which this is the anterior view of the tibia. This is the tibia. We have the part labeled H as the tibial tuberosity, as from the previous image which we have been able to see. And then we have the ankle joint. So this is the femur, and this is the tibia. This is the articulation site. We as well have the fibula just here on the lateral aspect of tibia, and forms a joint known as proximal tibiofibular joint. So this is the anterior view, then this is the posterior, while this other one is the lateral. As you can be able to see as well, the part labeled 14 is the patella, which I've just mentioned is the bone which forms part of the knee joint. So let's keep moving. We have the distal aspect of tibia articulating with the bones of the ankle or the bones of the foot. So we have with us the distal end of tibia, we have the distal end of fibula, we have the talus, which articulates with the tibia to form the ankle joint, and we have this other joint between tibia and fibula, which is a syndesmotic joint or the joint of distal tibiofibula. So let's move ahead and check the surface anatomy of tibia and its description. So we have with us the lateral intercondylar tubercle, which definitely tells us it's found on the lateral aspect. We as well have the medial intercondylar tubercle right here, which we have been able to see, and that forms the medial intercondylar eminence of tibia. We as well have the tibial tuberosity. We will check what's the function of this. We have the surface of tibia known as the anterior crest, which is the shin or the at the diaphysis, whereby we find out where this bone forms something like a groove. This is the most top part, as maybe for some cases, this is a major disarticulation between the tibia and the femur. You can as well be able to find this surface more clearly, which is the lateral condyle. We have as well the medial condyle. So this image is this image as well, but for this case, it's this part which we are talking about. So for medial condyle is this surface around here, while the lateral condyle is the other surface found on this part. We have the tibial tuberosity. So this is the anterior aspect of tibia, while the other side around here is the posterior aspect of tibia. Let's move to the description. This just but the posterior aspect of proximal tibia, and we have the tibial plateau formed by medial and lateral condyle. We have the solid or the popliteal line. We have the nutrients foramen. So remember, bone is like any other tissue of the body and needs blood and nutrient supply. So for this case, we have the nutrients foramen, which supplies the bone or supplies this tibial bone with blood and other basic nutrients. So let's move to the surface anatomy of tibia. And with us, we have the tibial plateau. Is the proximal tibial surface on which the femur rests. It's divided into two articular sections, one for each femoral condyle. So remember, when femoral condyle comes into contact with tibia, it rests on this part known as the tibial plateau. We have the other one, intercondylar eminence, is the rest area on the proximal tibial surface between articular facets. The medial intercondylar tubercle forms the medial part of the intercondylar eminence, while the lateral intercondylar tubercle forms the lateral part of the intercondylar eminence. And we have the medial condyle is the medial part of the tibial plateau, as I've mentioned from my previous lines. And we have as well the lateral condyles forms the lateral part of tibial plateau. For this, tibial plateau is made up with medial and lateral condyle of tibia that articulates medial and lateral condyles of femur, respectively, for tibiofemoral joint, which is as well known as the knee joint. So this is just but a brief description about those few anatomical structures found on the surface of tibia. So let's proceed and check other structures found on tibia. We have the tibial tuberosity, and this is found on the anterior aspect of the proximal tibia, which the patellar ligament of quadriceps femoris muscles inserts here, and the quadriceps femoris muscle, the major extensor of the knee joint. So you have been able to add points to your anatomy, or the anatomy about the muscle. So at least you have this muscle known as the quadriceps femoris, which is the major extensor of the knee. So we have the superior fibular articular facet, which is located on the posterior inferior edge of the lateral condyle, where the proximal end of fibula articulates with proximal tibia to form proximal tibiofibular joint. So this is the part now where fibula comes into contact with tibia at its proximal end. We have anterior border, which is the crest or shin, and that we are told that it's a sharp ridge that continues with the tibial tuberosity inferiorly and can be felt under the skin on a fine palpation. So you can just try to touch at the anterior aspect of your tibial bone, and you can feel a hard tissue just inside your skin, or let me just call it that, and that is the part known as the crest of tibia. So the tibial shaft is the fairly straight segment of the tibia between the expanded proximal and the distal end. And this marks other surface structure of tibia. Let's move ahead and check other structures. We have the sole or the popliteal line. It crosses the proximal part of the posterior tibial surface from the superolateral to inferomedial. The line demarcates the inferior boundary of the popliteal muscle insertion, which is a flexor and medial rotator of the tibia, and originates from the popliteal groove on the lateral femoral condyle. So the line itself gives rise to the popliteal fascia and soleus muscle, which is a plantar flexor of the foot. So it's just a line which is found on the posterior aspect of tibia. For whoever has the model of tibia, you can as well find the line which I'm talking about. So the nutrient foramen is a large foramen that exits the bone proximally, and it's found just it's found just inferolateral to the popliteal line. So the nutrients foramen, you can go back and check about the nutrients foramen, which it's right here, the nutrient foramen. Let's check what's its basic function. So we have the nutrients foramen is a large foramen that exits the bone in proximally. It's found just inferolateral to the popliteal line. So as I said earlier on, it's the point for where the neurovascular or the neurovascular vessel enters into the bone, which it's essential in supplying the bone with the required nutrients. So we have the interosseous crest. This is the lateral crest of the shaft which faces the fibula. It is the attachment area for interosseous membrane. And this membrane is a sheet of membrane that binds tibia and fibula together. It has other function, maybe dividing the compartments of the muscles of the posterior leg, and you can go and check more about the interosseous membrane and learn what is its other function. So let's proceed and check about, we have here with us the distal anterior surface of tibia, and with us, this a medial malleolus just projecting here. So let's check what's all about the medial malleolus, or what is its basic function. So for us, we also have other anatomical surface marks, such as malleolar groove right here. We have the fibular notch, which is found here, and this is at the lateral aspect of tibia. We have the inferior fibular articular surface, which is just right here. We have the interosseous surface, we have the interosseous crest, we have the superior fibular articular facet, where the fibula comes into contact with the tibia to form the proximal tibiofibular joint. So the medial malleolus is the projection on the medial side of distal tibia that forms the subcutaneous medial knob at the ankle. So its lateral surface is articular for talus body. So the medial malleolus is one which is especially can be felt at the lateral aspect of our ankle as something like a raised part, and that's what I'm referring to as a medial malleolus. So, okay, let's move ahead. The fibular notch is the distal lateral corner of the tibia, is the triangular and articular area for the thick short interosseous tibiofibular ligament, and this is the ligament that binds the distal tibia and fibula together as a unit, which is the syndesmosis. So, and that forms the distal tibiofibular joint, or it contributes the formation of that joint. So inferior fibular articular surface is a thin articular surface for articulation of fibula to form the distal tibiofibular joint.